ban in the Senate and the House.
I want to move to healthcare and kind of check with you because I think your position is changing or evolving based on something.
Fake news.
Fake news? Okay. Well, I want to run by you something you said last week. In a scrum with my fellow reporters, you said, we're 9 years into ACA. Let's stop bickering and look at the root issues. What is the art of the possible? And as I heard you saying that, when I heard you say we're 9 years into this, you seem to be accepting this is the law of the land. Let's deal with it. What can we do? Versus 2 years before when you went into a caucus meeting and said, let's get this effing thing done, in voting for the HCA.
Yeah, so again, things can be taken out of context, in which case both of those are. I'm a very pragmatic, problem-solving minded legislator, and that's a reputation that I've had since I've been in the House. And look, if we could start at the beginning, before the Affordable Care Act even was put into force, and identify what are the root issues. The root issues are people with pre-existing conditions couldn't get access to health insurance. We probably each know somebody who's in this situation. Somebody very close to me actually filed for bankruptcy because they had diabetes, because they couldn't afford their health insurance. They couldn't get access to health insurance, or people getting dropped, or the caps that were there. So we can't go back to where we were. I mean, there's some real problems that needed to be fixed there, and people were falling through the gaps. If they didn't get insurance from their employer, if they weren't on the employer market, or the VA, or TRICARE, or Medicare, or Medicaid, right now, that's about 7% of people that are on what we call the individual health insurance market. And you think of all the money and all the effort and all the kind of federal element that went into what the Affordable Care Act was trying to do, was trying to close that gap there, right? So that people who didn't have access to those other means could actually not be denied health insurance and get access to it. The reality is that the Affordable Care Act, the individual health insurance market, is the most unhealthy part of the market right now because there's so few options, because you don't have a balance of young and old and sick and healthy and everything. These are complex issues. And so the individual health insurance market, I meet people every single day who have pre-existing conditions who can't get access to health insurance right now because they're entrepreneurs, they're small business owners, they're in between jobs, they're retiring early, they're going back to school, whatever that is. That's the whole gap of that 7% of people. So if we could start all over again on the whiteboard and say, like, how would we address to provide more options for these people, I think it would be very different from what we've seen with the Affordable Care Act. But you live in the world we're in. And so what can we do now related to health insurance that actually provides options right now, today? So association health plans is one of those. We've got now initiatives in Southern Arizona where 15 chambers have come together, and it worked with United Healthcare, providing 17 different health insurance options for small businesses that they've never been able to have provided to them before. This is something that the administration came out with a rule on, but now it's being challenged in the courts. This is something that actually is working for people. So where can we, instead of the rhetoric right now, on the left you got people running for president saying the government take over healthcare, you have other people just repeating mantras on my side of the aisle. The reality is that people are living in the middle of all this, and they're frustrated with Washington, D.C., that they're not doing something right now to fix what needs to happen to provide more access to health insurance. So the Association of Health Plans is what I'm trying to do right now to fix a problem. Additionally, all of this discussion has nothing to do with the underlying cost of health care. Prescription drugs, surprise medical bills. Just because you have health insurance doesn't mean you have health care. And none of the debate over the last several years or discussion has been, where can we understand where the underlying health care costs are? And what can we do to try and drive those down with innovation, with technology, with transparency, all the kinds of things that are frustrating people all over the state. In my 15-county tour I did in the first 90 days, this is a top issue that came to me. From seniors not being able to avoid their prescription or afford their prescriptions, or again, moms who've got a kid who just got a diagnosis, not wondering if they're going to be able to afford the care for them. So the real world, everyone's living somewhere in the middle of all this, and I'm just trying to be constructive and thoughtful and listening and actually enact things that are in the art of the possible to fix the problems we're having right now.
So, and one of the reasons I bring this up is this was a huge issue in the Senate campaign last year, likely will be again. It's been in campaigns around the country, so I'm just trying to get a better fix if I did repeat some fake news there. Do you support the Trump administration's support? They're asking a federal judge to throw out the Affordable Care Act and declare it unconstitutional. Do you support
Again, it's not my role, but in my view, if we could start all over again, we would do it differently, but we are where we are. And even during the discussion on what would we have replace it, I repeatedly talked about how, look, guys, I'm a pilot, so I use airplane analogies all the time. We're landing an airliner, not a helicopter here. And so whether you like it or not, I mean, the impact of the Affordable Care Act has weaved itself into the way small businesses operate and the way insurance and hospitals and everybody operates. So these are really complicated issues. And so if we're going to move towards something better, it needs to be in a way where there's an off-ramp, and you move it in a way that you're not responsible then for, the Obama administration was criticized for, all the, if you like your doctor, you can keep it. So we don't want to be doing massive changes on a immediate basis in something that needs an off-ramp, even if we're going to go to a better model that provides more options and choice at lower cost. That's my practical view.